Uh, Hello, good morning, all of you. So today we have got Dr. Rifat Sharmin. She'll be discussing things about Gynae and Ops training post. Congratulations, Dr. Rifat. First of all, you got your training in Gynae and Ops because there are lots of candidates asking us how we can go through the process of Ops training. So thank you so much for helping all these candidates. First of all, I just want to say Dr. Sharmin, she was working in Ashford and the St. Peter's Hospital, and she worked there for around a year. And meanwhile, she applied for the training post, and now she got the training in University Hospital in Yorkshire. That's in North East, and she'll be starting in a few days' time because all the trainings are starting in August. So she'll be telling us in regards to all the things which she did during the preparation for this training, like FY2 competency, like the portfolio application, MSR interview, MSR exam preparation and interviews and all. So whatever questions you have got, all the listeners, those who are listening, those who are watching us, please just write it down. So we'll be able to answer your queries as well during the end or during the session as well. So, Dr. Sharmin, can you just introduce yourself and tell something about you?
Okay, so everyone knows my name, Rifat. So I started my working in this trust, my current trust, Ashford and St. Peter's Hospital, last year, end of April, and so my main target was actually from the beginning to know the system, because that's where we all lack of. We don't know the system. We are IMG, and so I focused myself on building my portfolios and also know the system so I can target the next training program, the coming one. So as I started on May, the next one was round 2 in August, which I didn't target because we need few times to know the system. When I started working, I still remember how I struggle myself. Like every day after work, I used to think, oh, why I came in this country. I don't know anything, but but I got very supportive environment at my workplace, and my educational supervisor was quite strict but quite nice person.
Mm.
So so I asked my hospital, the trust, for to build a portfolio like the HORAS. That's for the foundation year competency doctors.
Right.
So basically, because we are trust grade, we are not foundation doctors, so you have to, I think we have to get the things done by ourselves. We have to chase it, like, okay,
Right.
do something. I need this. If you don't ask, they will, like, okay, they will just use you guys, like the trust, which I think so.
That is true. Like if you are in the training post, so they have got the responsibility. But as you are in
Yeah,
non-training, so everything
non-training,
yourself. That is
you
something
have to do yourself. Yeah, no one will be responsible.
true.
So yeah, so but my as I said, my educational supervisor asked me, okay, go and do your portfolio, build it. So I registered for HORAs that
Mhm.
my trust gave me.
Mhm.
And in the HORAs, there are some few things we need to complete, like mini cakes, that is clinical observations, and some direct procedures. Some columns are there. So because I worked in trauma and orthopedics, I've done on calls and ward works, and so after doing, suppose I saw a patient, I went through the case, I discussed it with my registrar, and then asked them, okay, fine, I discussed it with you, and can you sign my HORAs?
Mhm.
So that way, I've done it one by one.
Right.
I did some clinical procedures as well. Clinical procedures, I would say, like, I did knee aspiration, because all are the basic orthopedics things.
Mhm.
But my focus was to fill up the forms, like, one by one.
Yeah.
And I've done my ALS. That is also one important things, I would say, because after doing ALS, I discovered myself. I'm so confident. I know how to deal, like when I do the on calls by my like individual, because in our trust the register are non-residential. They just go home after 8, so you have to manage yourself. They won't come unless it's very life threatening for the patient. So some clinical yeah, I had to attend the new patients at A&E, and then at the same time I had to manage my ward as well. So we had 1 or 2 orthopedics ward. So sometimes the patient gets very ill. So if you do ALS, like you can just like understand when the patient is going, what to do and when to escalate the things.
Right, right.
So yeah,
So,
so that is very important. Yeah.
Rifat, so how long it took for you to get your FY2 competency signed by your consultant?
So I worked around 6 months, I would say, like from May, June, July, August, September, October,
Hmm.
November, 6, 7 months. Yeah. So November when I applied, yeah, I went through that because I showed to my consultant through my portfolio that it's completed, is
Mhm.
signed by different registrars, and I've done it,
Mhm.
and also including my ALS also,
ALS.
ALS. Yeah.
ALS is like
So
quite.
yeah.
And regarding your non-training job, so which department you working? You're working in trauma and orthopedics for 1 year.
Yes, I worked in trauma and orthopedics in 1 year. I thought because I didn't focus on changing the department or something else. I just focused on building my portfolio, I would say, because I saw like nowadays people chase after medicine, A&E. Okay, fine. If you are, you need to know the system first. So I was very comfortable in my department. I did on calls, I did ward works, everything was covered, so I didn't bother. But later on, I my supervisor promised me to send me medicine, surgery. I did that. Like last 4 months, I was working in medicine.
Because
And
yeah, yeah, sorry, one of our users was asking like, as you're working in trauma and orthopedic, but you got the training in gynae, so how did that work? I mean, is it easy? Is it possible? So these kind of questions.
yeah, so as I said, like you need to work on your portfolio. That's important. It doesn't matter whether where you work or not, whether you work in gynae and ops or not,
Right.
honestly, because I will go through that later on, like what they asked me in the interview.
Mhm.
uh, so and also because my job was orthopedics, but I managed orthogeries as well. That's the medicine part. So trauma and orthopedics and orthogeries.
Mhm.
So that's why it was kind of medicine. And during that time, I was placed into the orthogeries ward, I worked with a medicine consultant,
Mhm.
and I worked on some research project and some audit. That helped me as well.
Right, right, right. Okay.
um,
And, so your portfolio, and how did you prepare for your application, and when did you start applying for this training course?
So I joined in NHS May. I start next the first November, the round one. So I say I was quite lucky that I could apply to the round one, because that was the first time they opened it for the round one for everyone. So the competition was like equal.
Hmm.
But previously, as everyone knows, like we couldn't apply to round one. Only few jobs were left in round two.
True.
So the application portal opened in around like November.
Mhm.
So I applied. It's a basic application that's for everyone. We have to apply through the Oriel.
Mhm.
Oriel. I opened an Oriel account and went through that one by one. So there were some questions like what I did, audit, research,
Mhm.
and my previous clinical experience, my current experience, whatever I'm doing now.
Mhm.
So I would say like when you um, fill up the form, just work on that. Take some time and go through that one by one.
Mhm.
Um, carefully, because if you just leave something, some important point. You work, because we all worked in quality improvement project research. These things mainly very important. Teaching, where
Mhm.
you have done teaching, and how many like you attend the teaching as well.
Mhm. Mhm.
So uh, okay,
Yeah.
so all of that things were included, and my other plus point was I did a course on ultrasound. I think
Mhm.
I got some points for that one as well,
Right,
but
right.
I didn't do MRCG any part, not part one. So that
Okay.
but that's
Like one of the good thing, like because a lot of people ask, like, is it mandatory to have MRCOG when we apply for the training post? So here
no.
we got the example. You don't need to, but yes, when you are in the training post, you definitely have to do it for later on things. I mean, to become a consultant, but to enter, it's not compulsory.
Yes,
But you need to work on your portfolio. You need to work on your CV. Like as Dr. Rifat mentioned, she did lots of teaching. She attended a lot of teachings. ALS she did, and the most important thing, she did ultrasound course, any audits. So these are the things, they are going to add up in your portfolio, and that will be really really helpful in getting the training post. Yeah, that's good.
exactly.
Hmm.
um so and the entry requirement is just you have to get your crest GMC first of all,
Yes, yeah,
and then the crest form needs to be signed. But
yeah.
for the crest form, the ALS is not mandatory.
Okay.
On the new one I saw,
Mhm.
you can just book it. You can just show that I booked it,
Mhm.
and get it signed from your supervisor.
Okay.
And that's all. And for the application,
Application process. Okay, and then you went through the MSRA. So
yeah.
how did it go?
So
How?
after that, they invited me, they longlisted me, and I got a mail around after 20 days, I would say, like in the middle of December, that you need to book your MSRA exam.
Okay.
That's the MSRA exam is mainly for GP and other some of the specialties, and Obs and Gynae is one of them. Obs and Gynae, radiology, and some others. 8 specialty you have to go through the MSRA exam.
All right.
So I prepared myself the MSRA exam for like I took 1 month for that, because
Mhm.
at the same time I was working as well. So it has got two part, situational judgment and clinical scenarios.
Mhm.
So the situational judgment questions are really difficult, I would say. Like whatever you think, you and choose the answer, and when you submit that, it comes up different
Okay.
things.
Mhm.
Mm,
Yeah. So they are.
so I there is a question bank, MCQ bank. I subscribe for that. People do have different opinions for MSRA exam, but I just went through some questions from the MCQ banks and went for the exam.
Oh,
But I would say for this specialty, Obs and Gynae, you have to mainly focus on the interview.
okay.
Rather, yeah, because the interview carries around 80% mark.
Right.
And so after that, I got the interview around January. Um, so I chose my venue in Manchester. I went there for the interview.
Mhm.
For the interview, there are 3 sections.
Mhm.
One is the structured interview section
Dr.
station.
Just one
Yeah.
thing. So, whosoever is giving this MSR exam, so all of
Mhm.
them called for the interview, or you need to pass in that exam to be called for the interview.
You need to pass the exam
You need
definitely
to
to
pass
call for the
it.
interview. Yeah.
Right, right, right. But yeah, I mean, interviews of like 80% of the marks, but you need to pass MSR exam to
Yes,
get.
you need, but if you don't pass as well, you will get chance later on. But
Okay.
yeah,
Mhm.
but you have to. Sorry, my answer was wrong. You have to just attend the MSR exam,
Okay.
and you don't need to pass it or not. It doesn't matter.
Right,
So
right.
based on your application, you
Mhm.
will get an interview call, MSR exam, and after sitting the MSR exam, you will get the interview call.
Okay, okay, okay. Perfect, perfect.
So
Right.
my guess is like whoever are long listed, everyone get calls for the interview.
Right. Okay, so you were mentioning about the interview. So yeah, that's the main area we need to discuss. Yeah.
Yeah. So in the interview is quite easy for us, I would say, and quite tricky as well, because
Mm-hmm.
we all came through the PLAB pathway.
Mm-hmm.
So there will be 3 stations.
Mm-hmm.
Two of them are pretty much same like PLAB 2
Okay.
exam. One will be clinical station and one is communication station.
Mm-hmm.
And the main one, I would say, is the portfolio station. That is called a structured interview station.
Mm-hmm.
So each of the station has got 10 minutes. So the
Okay.
first one is the structured interview station. That is, they will start asking. My first question was why you choose the obs and gynae,
Mm-hmm.
and I think that's the same question they asked everyone.
Everyone.
Why? Yeah, they just want to see your commitment towards the specialty.
Mm-hmm.
Um, yeah, so you have to actually focus on that question, like why you chose. I was like, I say like, um, because I think obs and gynae is like varied and like an exciting discipline in the medical science, and we can actually actively work in the hospital, in the NHS hospital, or if someone wants to just work like peacefully in a clinic setting, they can work in a family planning clinic,
Right.
or if someone is keen to do scientific works, they can work in the laboratory. So all varieties you can work. Is a diverse specialty.
Mm-hmm. Mm-hmm. True.
um, so that was my first question, why obs and gynae.
Mm-hmm.
Then the second, they asked me like, do you know the career pathway, like how the structures of this program, how it would be.
Mm-hmm.
So it is a 7 years run through program.
Okay.
So starting from ST1 to ST7.
Right.
ST1 and ST2 is the basic training, but we have to finish some competencies, and at the end of ST2 we have to finish MRCOG part 1.
Okay. Okay. Right.
And the intermediate section is MRCOG, the ST345. That's
Mm-hmm.
the intermediate part of the training, and we have to complete MRCOG part 2 on that. Part
Mm-hmm.
2 and part 3. At the
Ah,
end of 5 years, part 3 is completed.
right.
And then next 2 years is the subspecialty.
Mm-hmm. Mm-hmm.
So we can choose different subspecialties
Right.
like gynecological oncology, fertility, reproductive studies, a lots
Mm-hmm.
of there. That's the
Mm.
structure.
Okay. Right.
And yeah,
Mm-hmm.
so that's all. And they asked me about this, what you expect from this training program, because you know that there are lots of stress
Yeah.
in this, yeah, throughout this area year, and
Right.
there are lots of trainees actually drop off at the ST2, or after at the end of ST3. They can't take this pressure, and the rate of actually dropping rate is very high.
Mm-hmm.
So what do you think? Can you handle this? Like, that was my question. So I don't know what I said, but I know that I was very confident,
Uh-huh.
and I said that I'm very committed to this specialty. I worked in my country
Mm-hmm.
6 months, and I described what I did in the obs and gynae.
Mm-hmm.
I worked in a research project, and they were very impressed. They asked me to explain like what actually I did.
Mm-hmm.
It was a Obstetric and Gynecological Society of Bangladesh. They arranged a training program for the CS community skill birth attendance. So I explained all of them what I did. So yeah, they looked impressed on that.
Yeah,
Uh,
if you have any of these research and all, actually that puts a positive impression because they always want to
yes,
have someone who has got experience in the research.
exactly.
So that was a very good, like, positive point you had during your interview. Mm-hmm.
Yes, I think so. Uh,
Right.
um,
Did you have any what do you say clinical questions as well in the interview?
yeah, so this station, clinical scenario, I'll come that on that. So after,
Oh.
yeah, so this station, they later they asked me um, about my research, my audit, um, and they will actually ask to explain everything, like
Mm-hmm.
the topic of the audit, what was the outcome, and
Mm-hmm.
even the research, what was my role. And next question was what is the difference between audit and research, explain.
Mm-hmm.
What is the difference between leadership and management? Have you worked on any leadership? Do you have any leadership experience?
Mm-hmm.
What you did? So I had to explain all of these questions. And these all are very plus point, because I think whatever they asked me, I worked on that, and I was able to answer, okay, I worked on this and I did this, because that's all I focused all of these last 6 7 months after joining my NHS.
Mm-hmm.
Then the other question was, how many teaching you done teaching, so how many teachings you did, what do you mean by, how do you know that you are a good teacher?
Mm-hmm.
So, and then yeah, that's all. And later, so after all of this, they asked me like, if you have anything to tell us, because you have got that's 10 minutes station, I finished all of that in 7 or 8 minutes, I think. So they asked me, okay, you have got enough time, because all of the candidates, they told me that all of the candidates came before you, they took like 10 minutes, but you finished all of that, look very confident, it's very good. So you have 2 minutes left, do you want to tell something about you?
Mm-hmm.
So I was not well prepared, honestly, for the interview. I say like, maybe I'm not good candidate because I haven't worked in this country, in ops and gynae.
Mm-hmm.
But I know I'm very committed, and I will finish my whole training, and I will be a good gynecologist or obstetrician at the end of my training. And they just like started laughing. Yeah, you will be. Yeah.
That's also one good point. As you mentioned that you were able to answer all their questions in say 7 8 minutes, meaning your answers were precise and to the point. If
Yeah.
you are confident, then only you can do this thing to give like precise answers. Maybe rest of the candidates, they were not that much confident, or they were not that much sure what they were supposed to say. So that's why they took like long time. So that was good.
Ye-
Like you were aware like what you're saying. So that is good. Mm-hmm.
Exactly, because when I entered into the interview hall, like I saw like a lots of people sitting outside,
Mm-hmm.
reading a lot of things, papers, and I went there alone. No, I didn't have any sheets or something to memorize or nothing. I just like went relaxed in relaxed mode, and I thought, okay, fine, just because it's just like 7 months of my clinical NHS experience is, and I took it is the um I took it as a like not to take the stress, like just I know myself, I love this specialty, and I know I can get it. I
Right.
have the ability to get it. Why not? Like there will be lots of people, but I
Mm-hmm.
need to focus on myself instead of stressing me out.
Mm-hmm. Yeah, that's good. That's like if you are confident, you can do it. As simple as that.
Yeah, exactly. So the next station. So this is the end of this station. The next one was the clinical scenario. So they gave me a card. Mm, there were 5 scenarios.
Okay.
So 5 cases actually. So one of them, like it was like you started your on call
Mm-hmm.
for this for day on call, sorry, night on call, and you got 5 blips from different 5 different wards, and the nurses were asking you this, and
Right.
then 1 2 3 4 5
Mm-hmm.
tasks. So I have, because I'm starting my shift, I'm alone. I have to prioritize, and I have my F1. my F2 and other team members with me in my team. So you have to utilize that and
Mhm.
prioritize the things and prioritize myself, like which patient I am going to see, which one I'm sending my F1, which
Mhm.
one I'm sending my other colleagues, and
Sorry.
where I am going to involve my registrar.
Right.
So yeah, that's all that I told you, the ALS.
Mhm. Mhm.
That taught me how to prioritize the case.
Right.
Basically all A, B, C, D, E. So the station marking is first is the station is 30 marks total.
Mhm.
So each of the scenario has got 5 marks,
Right.
5, 5, 5, 25, and rest of the 5 is prioritization.
Mhm.
So I have to prioritize. I have to tell them, okay, this out of this 5 scenario, I will see case number A or case number B by myself. I will
Mhm.
send this case number C to my. I will ask my F1,
Mhm.
like that. And
Right.
some of the cases I can ask the nurses, or like some one of the station was like one of the post-op patient is complaining of pain.
Mhm.
Your nurse just called you, so I can ask the nurses, like, if any painkiller is prescribed on the PRN side, you can start
Mhm.
it and I will review them later.
Mhm.
um, so after that I had to elaborate all of the cases, like number A is very sick, I'm going to see that patient, I'm going to do A, B, C, D, all the examination. I have to verbally tell them, like,
Yeah.
okay, I've done the airway breathing, everything. And after that, what investigations I am going to order.
Mhm.
Investigation, like management, or before that, investigation, after that impression, what I think,
Mhm.
and after that management, what I'm going to do.
Mhm. Mhm.
And if anything needs to escalate to my registrar, if I want to ask involve, then I have to. And
Okay.
after that, case number C, where I send my F1
Mhm.
after. So I will take a clear handover from my F1, and then if needed I will review, or I will ask the F1 to do the management,
Okay. Mhm. Mhm.
like that. So
Right.
the last one was like the pain review. I can or I can give a call to the nurses just to know what's going on, like that.
It's also
So
kind
five
of like
station.
situational judgment. Like you need to judge the situation, like whom I'm gonna treat, whom can like my F1, F2 can treat, and where I need to have the registrar and all those things.
Yes,
Yeah,
situational judgment at the same time your clinical knowledge.
keep the knowledge as well. Right.
Yeah.
Perfect. Mhm.
So that is the station number 2. The
Hmm.
station number 3 was the communication station.
Okay.
So as I said, pretty much black too. So my task was like, there was a patient came, so I'm doing clinic, but my consultant had to go for an urgent work, urgent review for a patient, so I'm doing the clinic. So there is a patient who had appendicectomy, and it was the sample was sent to the lab and it came back that showing that the appendix was normal.
Mhm.
And but the patient was given a operated, and the patient was given post-op antibiotics for 7 days, and now he came back, so he's very angry.
Or she will be angry. Mhm.
So yeah, so that was quite tricky. The man was very angry. And when I started the station, he was literally shouting. So first few seconds I thought, what I'm doing, what I'm gonna do. But later you have to listen. So what I did, I didn't stop him. I just listened, whatever, all of his frustrations. I gave time to allow to express their concerns mainly, and then I started apologizing. Okay, I'm sorry,
Yeah.
whatever happened. And then I went through the like a little bit history, what happened, why
Mhm.
you came for the first time, and just to investigate the situation, what happened.
Mhm.
And after that, I offered him for my consultant review and some follow up. So at the end of the end of the station, he was fine. He accepted my apology. He cool and calmed down himself. So it was good. It went well. So that was a 10-minute station. So that was my task one, and task two was at the end of 6 minutes or 8 minutes something, the patient, you have to go to task B. Task B was the patient came back after 7 days again, and he was asking, he came to ask my apology because he was too rude that day.
Oh,
So he mainly came to ask apology, and now just talk to him.
right.
And so when I started, his that angry man was totally different in the
Okay.
same station. Yeah, and he started asking apology. He was frustrated because he lost his job and something. And then I asked, okay, what happened? What's going on in your life now? How you are supporting yourself? And then he said, no, I got a job again. I congratulate him. It was a very casual talk, 2 minutes. I think 2 minutes. Yeah.
Yeah, if
So
you
that's
talk, it's actually good. And as you mentioned, like angry patient. See, it's our mistake because he's angry because of our mistake. So what you need to do, just listen and
yeah,
listen carefully, and at the end, just address his concern. And that's the thing. If they're angry, you also become angry. Things will not go anywhere.
yeah,
That is what we have to
exactly.
do with. Mhm. Right, right. So it was a really good experience to listen to your interview and exam preparation.
Thank you.
So before you mention something else, I've got two questions. If I ask you one by one, I think most of them
Yeah.
are answered. So one is there: can we get our competencies signed in our home country, and would it be the same as getting it signed by someone already working in the UK?
Uh, I this answer I will just say my opinion because there are lots of controversial talk around this. Yeah, I don't want to hurt anyone. I just want to tell like there are lots of things in the crest form which we haven't done in our home countries,
Right.
honestly, to be honest.
Mhm, mhm.
So I don't want to mention someone's name, but I saw my colleagues who got the sign from the crest from sign from home country, and they applied for the training and they didn't get it. Honestly,
Oh.
I don't know the reason, but I saw that. And
Mhm,
also, yeah, it's not a difficult task, like if you just focus from the beginning after
mhm.
4 months, if your consultant is very helpful, you have to just show them, okay, I did these things, all of the things. If you can show the proof, no one is going to stop you get the sign, honestly.
Right,
And
right,
also, without learning the system, if you go to the training, you will not be able to cope it up, because when a trainee comes, they don't get any shadow. They start the on call. I saw them, my F2s and other trainees, they start their on call at the first day,
right.
honestly, and no one taught them. But when we start working, we get a lot of shadowing. And
Mhm.
also I saw my colleagues getting like 2-3 months shadowing on calls and other stuffs, even the normal ward staffs as well. So the amount of support we are getting, we will not get if we are in training. So
Right.
I would always suggest get some training, get some non-training jobs, know the system, then come into training.
Yeah, that's absolutely right. I mean, see, if you are getting it signed from your home country, you are fulfilling that criteria. That's fine. You will be able to do the exam. You will be able to give the interview. But definitely, I think they are going to prefer someone who has done the FY2 competency from here, from the UK, because
Exactly.
the system. So when they start doing the training, they won't be having any problem. Like for you, so as you're starting from 5th of August, I guess.
Yes.
So from 5th, 6th, maybe you will be given on calls. They can give you confidently, and you will
Yeah,
be
my first day is ops on call,
open.
honestly.
I mean,
Yeah,
I think you can do it easily. You don't be having any trouble, any problem, and all because you are aware of the system. So that's the thing. So the answer
exactly.
to this question, I would say yes, you can get it signed from your home country as well, but preferably if you do it from the UK, the chances of getting the training will be higher. That's it.
Yep.
And another one is asking, do you think research in any field other than OBG would help?
Yes. So I never worked in obs and gynae, as I mentioned. just did 3 months internship in my country. So
Mhm.
I did, my research was mainly in medicine, orthogenesis medicine, and it got published as well. So I got one publication. I'm currently working on two more. It's finished, just like
Mhm.
waiting for to get published. And I did two audit as well. One was orthopedics, one was medicine.
Right, right, right. Perfect, perfect. And also, if someone hasn't worked in OB/GYN at all, would it have a negative impact? I think we have answered this question. It's nothing like you need to
Yes.
work in that, as you know, Dr. Rifat. She hasn't worked in gynae. She was working in trauma and orthopedics, and she's here with you, and she's gonna start the training in next few days. Right.
Yes, and the
Uh,
same exact question, exact question they asked me in the interview, my portfolio station, like, have you worked? I said, no, I haven't worked, and this is not a requirement. I saw that, and but I worked in my home country, and then they went through all of that, like what I did.
right, right. See, even if you haven't worked in, of course, in your what do you say, internship, you definitely have worked in gynae for at least a couple of months, so you have got something there.
Yeah,
Yeah. So working in the UK is necessary, not like you need to work in the gynae only to get gynae training.
yeah.
Can CREST be signed as SHO in any specialty? For example, OB/GYN doesn't have many opportunities for DNAR.
I think gynecology do have DNR.
Yeah, they do have. So, I mean, I think the CREST can be signed as SHO in any specialty, isn't it?
Yes.
Yeah, so you don't need to be working in one department itself, so you can get it signed. It doesn't matter which department you're working
Doesn't matter.
in.
Decide like gynecological oncology has got the DNR because the patient, if the patient is in the stage of cancer,
Mhm.
she can have.
Yeah. Because I think the user might be thinking that mainly if they are in that stage, so you will be calling the medicine people and they'll be taking over the things. But no, not that the case. Because as you
No.
mentioned, we have got gynae oncology as well, so you will be having these kind of patients as well. Another one is that do you think ST3 training in ops gynae could be secured or it's very difficult? Like directly ST3, what do you think?
So there are certain requirements for ST3. If you get that requirements done and the competencies, obviously you can.
Mhm, mhm. Yeah, definitely. It all depends on competency, but I think Dr. Rifat, she is going to the run-through
Yeah.
program where you don't need even MRCOG, but if you want to apply directly to ST3, so maybe you need to have at least one first part of MRCOG
Yeah,
to.
MRCOG part one is the
Hmm.
requirement for ST3.
Yeah, as she mentioned, like she also has to do when she'll be doing ST1 and 2, she is supposed to have MRCOG first part. So it's the same when you are going in ST3. So if you are able to show your competency till ST3 and you are done with the exam MRCOG part 1, so yeah, you can do it. See, and person is asking, is it difficult? Very difficult. See, nothing is difficult if you prepare in a right direction, I would say.
Yes, exactly. And also, while working in the NHS, there are some courses which under the Royal College of Obs and Gynae. So, as an F2, we can actually do that things, but I didn't get chance because it was quite expensive. And some courses like basic practical skills and Obs and Gynae, this is a very important course. If you do, and then you can tell that in the interview, I have done this. That is
Mhm.
also in the, like, we have to do it now because in our ST1 ST2, but you can do it as a non trust grade doctor.
Yeah. So, I mean, anything if you have done extra is going to help you in the interview. And also, I think in
Exactly.
these kind of small programs or in while doing ALS, I think lots of trust, they do help as well. I don't know, like about your ALS. Did you get anything from the trust or you need to pay by yourself?
So first I paid and then claimed because I had £700 my study budget,
Right.
so it
Mhm.
covered.
Mhm. Yeah. So, I
So
mean, you can.
this course is the course I told, like basic practical skills. I That's around £300, but the trust will pay after completing the course when we have to do submit the certificate. And like the ALS also same. The pass certificate, if we go give them, they will pay us back.
Right. So, I mean, as you can say, NHS is great. Great. I mean, they want you to study and
Yeah.
try their best, like to compensate a lot of things, like all these courses if you want to do.
Yeah, and we have to know this system as well, like the study budget, study leave, these things. as I said, like we have to ask for that. Otherwise, no one is going to give it. The trust never told me that you have got 700 pounds for a study budget. I had to find, okay, how to cover it up. I had 7 days study leave, which I used, which people can use like as a tester week in other working in other specialties like obs and gynae. You can do 1 week by taking your study leave. So you have to like find it out, like what I can do, what I can take from the trust.
Yeah. So definitely, they won't be coming forward to tell you, okay, we have got 700 for you,
Yeah,
this thing. You need
never.
to find, yeah. So
You
you need
need
to
to
do
exactly.
extracurricular activities as well. I mean, find what have you got. But definitely, every trust have got these things, ALS, and I know many of my
Yes,
friends
a
cited.
lot of things, but which we don't know,
Yeah,
honestly.
yeah, yeah.
Even if
So
we do these courses, we can get it like as a leave time back. Like I worked in I did my ALS, so that 2 days I got it as a like my off days as well, like
oh,
as a leave. There are a lot of things we need to work. That's why I say like NHS is great, but you need to know the system and you need to know how it works.
and you will be knowing it when you start working, like maybe in the non-training post, and you will be slowly getting the idea. I know you're working for last 1 year, but still, I think there are a lot of things you still need to
Yeah,
find out what is
find
happening.
out
Yeah,
exactly.
yeah. It's like day by day you are learning. Even if you're a consultant, still there is something you can go and learn there.
Yeah,
And everybody has to done
exactly.
the teaching session as well. It doesn't matter you are a consultant or which rank you are. You need to do the teaching sessions and all. You need to make sure that you are updated to the guidelines and everything. So this is something I like about NHS.
Exactly.
Right. Anything else, Dr. Rifat, you have to say regarding anything for your gynae or anything? I think we have
Uh,
answered questions here.
mm, I would say like you need to like for any specialty, for any training, you need to be very commitment. You need to have that commitment. You have to be committed towards that, and you have to be confident enough. That's what we always lack of. And when we start in NHS, like there are some like peoples around us which whoever will try to say, okay, you don't know these things, but you have to work on that and show them like I can do anything because
Mhm.
we know better than anyone, like we are the best.
Yeah, you have to have that thing, the best. So then only you can work. Like, okay, you don't. You told
Yeah,
me I don't know. Okay, I'll show you how it is done and how I'll tell you. Like, I did it. Yeah. So that is something
yeah,
really important.
yeah.
Definitely. So, Dr. Rifa, thank you so much. It was like really a wonderful session, and I think it was like very straightforward the way you have explained. I don't think so. Anybody will be having
Thank
any
you.
doubt here. So, and if anybody has got doubt, we'll be seeing like and
Yeah,
you can tell
I
us.
am always available. Yeah,
Yeah,
I can help
definitely.
anytime.
Yeah, because when we did
Thank
our
you
first.
for giving me chance.
Thank you so much, first of all. Actually, the way you have explained, and thank you so much when I just asked you, and you are like ready, said, yeah, definitely, I'll be able to do it. So thank you so much for that. And because a lot of candidates actually, when we did the psychiatry session, GP session, there are a lot of candidates asking about the gynae ops. We're like, okay, let's see whom we can find for gynae. And suddenly, yes, I came to know that you got the training course. I think like the best candidate I mean we can have so that she can explain the training pathway and
Thank
all
you.
and what happened in the interview and all those things. And the way you have explained in detail, actually, the way you have explained, we're thinking it might be like a very small session, but you took your time and it's like more than half an hour and explained it really well and answered all the queries all the users have got. So thank you so
Thank
much,
you.
Dr. Thank you so much. It was really, really nice. Thank
Thank
you.
you.